One of the most common questions that I get on my Instagram, mostly on my Instagram, is from pregnant women who are asking me whether or not it is safe for them to continue weightlifting during their pregnancy, especially in terms of their pelvic floor and their core, and reducing their risk of things like diastasis, pelvic floor issues, prolapse, incontinence, all of the above. So today's topic is all about lifting during pregnancy. Someone is also mowing their lawn, and I'm not sure if you can hear that, but hopefully it's not a problem. First of all, pregnancy is a time where your posture changes dramatically. We all know lower back starts to get a lot more arched. You grow this belly, your breasts start growing, your uterus grows, your pelvis changes position, all of the above. Now, this postural alignment is really important when you're talking about loading tissues in terms of like adding weight or continuing on with resistance training. So we have this thing in science and it's called length tension relationship. And it basically describes that when a tissue, such as a muscle, is either at a shorter length or a longer length than it normally is, it doesn't have as much ability to generate tension or good tension or the level of tension that it would if it was at its normal length. So in the event where your posture changes and you're now getting shortening of muscles, say lower back, when you've got this big lower back arch and the front of your belly starts to lengthen, those tissues are longer, that ability for those muscles to generate tension is now less. So it's not as efficient, and that's okay because we're pregnant and things happen and you need to continue on dealing with the changes that occur during pregnancy. Now, the length tension relationship is really important in terms of weightlifting because you might generate more tension in some muscles than because they're not as affected, and other muscles aren't really doing their job as much. So we get these like mechanical loading changes around particular joints or around movements that are different to what they were prior to pregnancy or prior to those postural changes. Then after pregnancy, you go back to like changes in those posture and those tissues and their ability to generate tension, and it's a different cycle again. So if you're trying to maintain this like strength training program during your pregnancy, that's probably, you haven't dropped the intensity in terms of the load, or we're a little bit more like, is it really necessary because your whole system is changing the way it's performing different movements? You might not really notice it, but your center of gravity is changing a little bit. How you squat's going to be a little bit different. How you deadlift's going to be a little bit different. How you do push-pull movements is going to be a little bit different, just based on that postural and alignment changes and how those muscle tissues are working. So that's point number one. Point number two is that we have this trusty hormone called relaxin, which I'm sure you probably know about, and its job is to basically make pretty much all of your body nice and lax and loose so that it can shift around. This is really important for the birth especially, but mostly for your pelvis, because your pelvis needs to be able to open and expand so the baby can come out, but also it kind of creates a little bit more space for you to grow and the pelvis to shift open so that you can now hold or grow a human inside you. Now, when everything is really lax and really loose, this whole system becomes less stable. So stability being pretty important in terms of like making sure you're not at risk of injury. So joints, ligaments, muscle tendons, everything becomes highly mobile, less stable, and more at risk of injury. So things like stress or strain, muscle tissues, tears, ligament damage, for example, are all things that you are now at risk of just because your tissues aren't as stable or the joints aren't as stable as what they normally are. So also keep that in mind while you're adding load in your resistance training program. When we're programming strength training or resistance training or lifting during pregnancy, we're basically making sure we're considering the safety of the mother and the fetus during this time. So does the benefit of the exercise outweigh the risk that's involved by doing it? So does the weight need to be that heavy? do you need to actually perform that particular movement? Let's take, for example, a heavier clean and jerk movement or a snatch movement that you might be doing in those functional or CrossFit scenarios. These exercises are highly loaded. They're a little bit more like what we call ballistic movements, which is basically like really quick rebounding, almost like plyometric work, where tissues have to like contract and relax really, really quickly. And we're also moving a lot through movements that might be at risk. For example, barbells coming up across the abdomen. If you are heavily pregnant, you are at risk of impacting. So you will naturally pull the barbell over your belly to keep it from hitting it, right? Which is now a mechanical change in movement. That's what I'm talking about from earlier. So those movements, are they really beneficial for you? Or can you just like not do them and switch it out to a different exercise? I would recommend switching those out. Olympic lifting, by the way, is also classified as a contraindicator during pregnancy based on that risk of impact loading during the lift. So please keep that in mind. We want to make sure that during your pregnancy training that you're putting a large emphasis on core training. This is to help alleviate that possible low back problems and issues around stability of the spine because of those postural changes. And we don't want to have any excessive, forces or pressure basically going through that lower back, the joints of the lower back, and causing you more problems because the joints just are getting a lot more impact loading and forces based on that excessive lumbar lordosis or curvature of the lower back. So we want to focus on things like static core work, which are things like a plank version, or you might do a farmer carry. You might be doing like a dead bug exercise or all fours, opposite arm and leg raise, for example, where the core itself or the trunk is actually switched on and keeping you nice and stable in a more of an isometric contraction, rather than doing something that's more dynamic like crunches, where you're actually moving that trunk and it's changing postures and positions, and we're putting lots more strain and stress loading on the lumbar spine. And those movements are going to become quite difficult as you progress further down pregnancy and you can no longer have the space to do crunches, for example. We also want to be thinking about the rep range that you're doing. So things like we want higher rep ranges where we're doing something more like 10 reps. I wouldn't go anything lower than probably 8 reps, but 10 reps and more. And we're doing like a 70% loading of our 1RM. So that means like you're not really working to muscular fatigue as much. And we're trying to basically balance out all the muscle groups that we're training, really focusing on those areas that need help with managing those changes in posture. So things like back support, glute strength, core strength, leg strength to carry you, as well as all different planes of motion. So make sure we're rotating, moving forward and backwards, as well as like in sideways movements as well. We want to avoid things like Valsalva. So if you don't know what Valsalva is, this is pretty much like your breath hold exercise. This is something that a lot of women do to create stability instead of using their core muscles. So they'll hold their breath and brace and then do movement. Sometimes I've caught people doing their whole sets of 15 repetitions without breathing. Now, when you have Valsalva, you're actually increasing your blood pressure and your heart rate, and possibly changing the way blood is being distributed throughout your system. So you want to avoid that. Make sure you're breathing in on the easier part of the movement and on the push part of the movement or the harder part of the movement, which is the concentric part of the movement. For anyone that knows what that means, we're breathing out and exhaling, so that we're making sure that we're maintaining your breathing pattern throughout all exercises, especially also in those isometric hold exercises where you might be in a plank hold or a squat hold or something where you're just holding the exercise. Make sure you're continuing to breathe through that, because isometric exercises also raise your blood pressure as well. Now, let's talk about the core and pelvic floor. The core is basically a recap, is made up of your pelvic floor. Your transverse abdominis is the midsection right around your abdomen, adjoining to your pelvis and your rib cage. And then your diaphragm is at the top. So you have this core canister. If you don't know what that is, there's plenty of videos on my YouTube about this already. You can go back and watch one of those. However, you want to make sure that the core canister is your main focus in terms of like making sure you're safe in terms of core and pelvic floor health. Now, as you go through pregnancy, baby grows, it puts a lot of downward pressure onto your pelvic floor. You also have changes in posture. based around what we've talked about earlier. Your pelvic alignment also starts to switch. I want to give you an example. So sideways, your pelvis is nice and neutral when you are pre-pregnancy, or should be neutral. And as you start to basically get bigger, you have this excessive lower back. This is your lower back here. The lower back starts to curve more, your pelvis rotates forward. This is what we call an anterior pelvic tilt. And the baby is now growing sort of out the front here, and your belly starts to expand. So you can see here now that because of this change in alignment, you also get changes to that length tension relationship of your pelvic floor. So there's going to be parts of your pelvic floor now that just don't generate as much tension because they're either lengthened or shortened in comparison to this neutral pelvis that you actually have. So that is problem number one with your core and pelvic floor. Problem number two we spoke about is the fact that it's already under load. It gets a little bit more stretched, should we say, as the baby pushes down. The pelvis starts to widen a little bit and we get a little bit length of these tissues, and it becomes a lot harder to contract and relax as well in some cases. So you want to be mindful that the mechanical changes around your body are also affecting how well your pelvic floor is functioning just generally. When you lift heavy weights, your core and pelvic floor basically have to be able to withstand the amount of pressure that happens or increases within your abdomen. So your core is going to switch on a lot because it's going to build a lot of pressure inside your abdominal cavity, or what we call intra-abdominal pressure. Your pelvic floor has to come up and hold up against it. Your abdominals have to come in and hold in against that to keep everything nice and stable, nice and safe. In some scenarios, when women lift heavy, they actually push down onto their pelvic floor, or we call this bearing downwards, and it puts more excessive load down onto the pelvic floor rather than being able to like contract it and hold up against that pressure. So when tissues are under constant load and constant stress that is above what they should be experiencing or the wrong way, for example, bearing down, then these tissues, after long-term exposure to that, can become really, really weak and start to dysfunction. This is where we see problems with things like pelvic floor dysfunction, especially postpartum, or risk of, say, prolapse, because you're pushing all the pressure that you're using to like lift the weight down onto the structures of the pelvic floor. So that's ligaments, tendons, and the muscle tissue itself, as well as all the organs. So just think about, like, if you're constantly bashing down onto that and it's not really doing its contracting, relaxing job very well, then you're putting yourself at risk of things like pelvic floor dysfunction or prolapse, hernias, for example. All of that is also pressure-based things that could occur based on this like downward bearing down activity during lifting. So if you are lifting and you are finding yourself pushing down and bearing down onto your pelvic floor, this is the first thing I would look at changing. And maybe that weight's just a little bit too heavy. When you're lifting weights during pregnancy, you should not be straining during this time. If you have to strain to lift those weights, it is too heavy. You want to be able to control your breathing, control your abdominal contraction, control your pelvic floor contraction, and most of all, make sure that the technique for that exercise is on point. If you are lifting too heavy where your technique is starting to like fall off, perfection, not perfection, but optimal, then it's too heavy and it's not appropriate for a pregnancy load. We're at a time where we're trying to maintain some strength that we have or prepare our bodies for birth and beyond, not try and improve performance. So you don't want to be trying to lift heavier than you normally do at this time. It's just not the safest time to be doing this. The other thing that we're really conscious about with lifting in terms of pelvic floor safety is the breathing pattern. So remember, no Valsalva, no breath holding. And then, like, if you're putting pressure onto your pelvic floor, you can't contract it very well, you're holding your breath, like, is this exercise really appropriate for you? Is the risk higher than the benefit? If you feel like, probably shouldn't be doing that, then you probably shouldn't be doing that. Not to mention the effect that it's going to have on your muscular system in terms of that mechanical changes and mechanical loading and how your body is performing those big functional lifts and the motor control patterns of different muscles firing at different times to do that movement. Most of the time when I'm training women who are postpartum, I see so many changes in terms of how they're performing movements based on the postural changes that have happened to them during pregnancy. So their squats just don't look as good anymore because they just don't have the strength in places that they had previously, because the strength or the length tension relationships changed, or their motor control system has changed. Their posture still feels funny. it's not really back aligned properly, or their core muscles aren't working very well, so their center of mass and gravity is off. And this is all stuff that may have stemmed from overloading muscle groups in pregnancy, because you just didn't really know that you shouldn't do that. So let's recap. It is safe to lift weights during pregnancy. However, how you do this is really important. And what exercises you choose to do is also really important, because we want benefits from them, not risks. How you regulate intra-abdominal pressure, contract your pelvic floor, have your lower abs on, make sure you're breathing, is all really important in terms of your safety. So if you're just doing simple bodyweight squats and you're doing everything wrong, that can almost be more risky than actually lifting weight, doing it the correct way. So keep all of this in mind if you're strength training or continuing strength training during pregnancy. If you're heavier lifting, I do advise drop down the intensity, go for that higher rep range, drop down below 70% of your 1RM, and make sure you're not straining. It's not a time to be an athlete and continue increasing your performance. It's about maintaining what you have, being healthy during your pregnancy, and being able to prepare your body for birth and beyond. If you find you need more help, please reach out to someone like myself who can help you with your programming or give you a little bit more general individual advice for you. You can find me on my Instagram at her.exercise.physiology. Check out my website, and everything I do is on a virtual clinic. So I can help you from wherever you are, and we can do it all through the virtual world. So please get in touch. If you like this, please give it a thumbs up. Please subscribe to my channel, because I'm trying to upload videos every single week that are helpful for women's health, pelvic floor, incontinence, training, pregnancy, all of the above. And share this amongst your friends. See you next week. Bye.